Hello, everyone. Thank you for joining us today. My name is Sasha Sicard, and we are having a live conversations with Dr. Darius Dawson and ADAA Ally Tiara Johnson. We're going to have them join us shortly and get started. Dr. Dawson is a PhD in clinical psychology and is a research investigator with the VA. Hi, Tiara.
Hi, how are you?
Moderator today. She is an author and a consultant, communications consultant here with ADAA. We are so excited to have her. She just recently graduated from Georgetown with a master's in public relations and corporate communications. And here is Dr. Darius Dawson. Thank you for joining us, Darius.
Hi, good to see you.
Good to see you too. I'm so thankful to have you both here with me today. I'm going to hand it over to Tiara so we can get this conversation started.
Well, hello, everybody. As you kind of heard our introductions, my name is Tiara, and today I have the pleasure of talking with Darius Dawson, who I'll give him a chance to kind of introduce himself. But we decided that it would be very beneficial to kind of take these meaningful conversations that ADAA is committed to and kind of taking it to a more conversational tone, which is here on this platform. And so we're going to have a brief conversation, dig into some things. I'm really excited for you guys to just learn a little bit about Darius and about his background and how that kind of relates to a lot of the themes that are going on right now currently with mental health, Black mental health, and even Black History Month. So Darius, do you want to introduce yourself really quickly?
Sure. So I am Darius. I have a PhD in clinical psychology. I am a researcher here in Houston, Texas with the Houston VA and Baylor College of Medicine. And I also do some clinical work in the area of anxiety, tobacco cessation. So I'm really excited to have this conversation. Black mental health is very important to me, obviously, but I also like to be able to spread information whenever I have the opportunity. So
Well, great. Well, we won't have a long-winded conversation. Hopefully this is about 20 to 30 minutes, but I do want to first start off and ask you, you've given a little bit about your profession, but let's talk about how you actually became involved with ADAA.
Yeah, so ADA had an opportunity for professionals of color who are interested in anxiety and depression, and I applied for the scholarship program, and I was selected, and we have the opportunity to meet, every month to discuss, ADAA and some of the opportunities that ADA provides. And we also have access to a broader community of researchers and clinicians across the nation who are doing anxiety and depression focused work.
Now, I know that you are kind of new to ADAA, and in a moment of transparency, so am I. So out of the type of things that you just mentioned, some of the perks that come with being a member, what have you seen that you've enjoyed the most so far? Or what's been as beneficial to you?
Yeah, I think having access to other professionals who are doing the same type of work that I'm doing is really great. Expanding that network and having the opportunity to discuss some of the things that I've been working on, and you kind of feed off of other people's professional careers and growth, and you meet people at all stages of their career. And so it's been really nice to have that access, which I wouldn't have otherwise.
Yeah, I think that really makes ADAA kind of stand out from a lot of these other professional organizations where they do kind of leverage this community of professionals. I know me, on a personal note, when I first kind of joined ADAA or became familiar with it, I love that they had this kind of hybrid model where not only were they kind of dedicated to their public audience, but they also did a lot to make sure that their professional members, could contribute to that as well. So let's jump into the power of, Black mental health, and definitely during Black History Month. In your professional experience, what are some trends that you've seen so far as it relates to Black mental health?
Yeah, so I've been a clinician and researcher since about 2012, 2013, and I've definitely seen an increase in the awareness of the benefits of mental health among Black people. And I think specifically with the younger Black generation, there's a lot of acceptance and a lot of dissemination of information about resources and the benefits of mental health treatment. And I've definitely had the opportunity to have a lot of real discussions with patients about being Black, about what that experience is like. And that's been something that's definitely increased over the past few years. And even though there's more awareness of the benefits of mental health and the the goals and the things that you can achieve in treatment, I think there's still a little bit of a stigma that exists. There's a little bit of skepticism around, what does that process look like? What are some of the things, about confidentiality that I have to deal with? How beneficial will it actually be when I think about some of the costs and the stress of having to deal with some of those conversations. It's a difficult process. And so what are some of the benefits I'll actually get? And I think that with COVID-19, with George Floyd, with some of the things that have been going on in the past couple of years, there's definitely been a heightened awareness that, seeking treatment is going to be beneficial. And I think that if we can address some of those logistical barriers around costs and transportation and fitting it into a demanding schedule, I think, we'll get to a point where it becomes more and more accepted among Black people.
And I like how you mentioned the fact that you've seen kind of this increase and this rise, because like I said, even on a personal level, I definitely consider myself a mental health advocate. And I actually took the leap of faith in writing a book about Black mental health during the 2020. Like you said, a lot of the things that you mentioned about George Floyd and Breonna Taylor, I even had my own panic attack that I was surprised that it happened, and it kind of transpired into me kind of on this journey. So when you think about the benefits, I know you kind of mentioned if we can get past some of these barriers, what would you advise to somebody from our community who is a little hesitant about taking that next leap of faith with kind of understanding and embracing their own mental health?
Yeah, so I always tell people you can't have strong, successful physical health if you don't have a strong, successful mental health, and vice versa. You can't have strong mental health if you have poor physical health. And so the connection between those two things are so great and it's so strong that we have to focus on both things. And specifically with some of the stress and the pressures that Black people have to face in America, we have to give ourselves the opportunity to learn about ourselves, increase our coping mechanisms, increase those, the ability to have those conversations among other people. And, it's a scary process, and I definitely understand that, but I always tell people if there's fear of something, that means you should approach it instead of avoid it. And to everyone, if you have a fear about something as it relates to mental health, then there's maybe an indication that it's something that you should approach and you should just go for it. And the costs of that and the downsides of that are far lower than the benefits that you can experience if you go and learn about yourself and grow. And it's really an opportunity there for you to grow and to learn about who you are and some of your defaults and your behaviors, and how to be a better person and functioning as a better person in society.
So one thing that you said just now that really stuck out to me, because I was a little hesitant, I'll be very transparent once again, I was very hesitant about actually seeking out a therapist. I actually haven't just sought out my first therapist earlier this year. But the one thing that actually helped me, I know, and you mentioned it just now, was being having the courage to have those conversations and really being able to kind of vocalize and just say that maybe you're not feeling well or not, having the best moment. And it kind of leads me into my next question with you, is that we talk about the Black community having the stigma, but I feel like almost for Black men, it's like a double stigma, in the sense that there's this maybe role or just a idea that Black men have, that they're less transparent, or they have that hesitation, I'll say, to be courageous in explaining or describing their mental health struggles. So as a Black man and a mental health professional, what are some common misconceptions that the Black community has about the expected role of the Black man?
Yeah, so I think you really, addressed it a little bit, is that there is this sort of role of responsibility, and we are not necessarily reinforced for expressing emotions. But within the Black community and outside of the Black community, Black men are reinforced for that athleticism, for intelligence, if they're masculine, if they're a leader, if they, take on all of their responsibilities. But whenever we express emotion, if we're having difficulties with some type of situation, that is not really reinforced. We're kind of told to, just deal with it and move on. And part of that is because if a Black person, and specifically a Black man, does express emotion and it is deemed as too much, or it's outside of the scope of comfortability for other people, it's seen as being violent or threatening or dangerous. And then on the opposite end, it's seen as being ineffective or weak, or you're not the good representative of the family or the Black community that we really need you to be. And so it's you kind of have to keep it in a range that is comfortable for other people while sort of minimizing what you're feeling and what you're going through. And so we have to navigate our own issues, as well as navigate the family's issues, as well as navigate society's perceptions of who we are, which sort of, is a lot to deal with and a lot to balance. And so one thing that I'll also say is, when Black men advance in education and advance in society and their career, and they have a sense of financial stability, and they try to do better for their families and try to do better for their community, you're sometimes faced with more discrimination and more racism and more social pressure because you're penetrating white spaces. And so that then results in some of that stress and that pressure. And, whenever you have the opportunity to advance yourself in society, typically you are protected from some of those different pressures, but we don't see that for Black men.
And so I wonder with you, if you don't mind getting a little bit personal, you've definitely accomplished a lot in your life, kind of stepping outside of this societal barrier or box that maybe the typical Black man or other people may see as a typical Black man. What were some of the obstacles that you had to navigate in that sense, and how did you overcome that?
Yeah, that's a really good question. I never really faced many microaggressions and discrimination until I got into grad school. And so it was kind of an unexpected experience where I had to face the fact that no matter, how many accomplishments I made, how much I had proven myself as a person, I contributed to society, I was a good person, I had a good personality, I was still seen as a Black man. People just kind of saw my Black skin. And so I had to kind of get to a point to where I felt that I disassociated between what other people perceived of me and how I perceived of myself. And I had to do my own learning and learn my history and learn, who I was as a person, and found people in the system who supported me and who were willing to have those conversations with me despite some of those other conversations. And so it is something that you don't want to have to tell people, but you have to stay focused and you have to just go against some of those things, because at the end of the day, it's your life and it's your journey. And unfortunately, that's another expectancy of people of color in America, is that you do have to just deal with it and you have to move forward, because you're the one who is going to have to, make sure that you have a career and have an education.
You, like I said, you're hitting a lot of the themes that I can relate to, definitely on a personal level. But one of the things that you kind of mentioned and dabbled on real quick was the importance of allyship, or like having somebody to like talk to in those spaces. Real briefly, do you think, or how important was having that ally or having that sponsor, whether that be a person of color or somebody of an opposite race?
It was so important. I mean, having someone who is a part of the system, who maybe isn't, doesn't look like you, who has other types of knowledge and other types of connections, can really advance your understanding of the system, and they can kind of stick their neck out to help you in a way. And so I was able to find that at every stage, at every institution, and that was really something that really helped me, because I was able to trust in someone that they had insight into something that I would never have the opportunity to have insight in. And whenever you can have that conversation with someone who understands your experience and really sees the value in you as a person, despite, your skin color or your gender, you can really have a sense of protection and psychological safety to bring up some of those issues that you may be having.
Exactly. I feel like a lot of people always say, we hear you, we see you, but they really don't realize that it's little things like that, being an ally, being a sponsor, that really helps us as a community, as Black people, really feel seen and heard. So I'm glad that you were able to kind of elaborate on that. Also, what advice or tips do you have for Black men who may be struggling right now with the societal pressures to fit into this expected box or like this expected role?
Yeah, so the one thing that I tell people is to really develop a sense of self. I know it's an abstract concept, but whenever you can assess your self-worth and really grow your self-worth and develop a respect for who you are and what you stand for, and you can, increase your self-esteem and your the like and love for yourself, you can withstand other people's negative perceptions of you. We can never control what other people are going to do, how other people are going to respond to us. We can't change people's perceptions immediately. And so the only thing that we can control is how we think about ourselves and who we are. And whenever we take that opportunity to increase those aspects, we really can create a protective barrier between us and negative perceptions or discrimination and racism. And I had to do this, within the last, 5 to 10 years, where I really asked myself some questions about who I was and what it meant to be Black and what it meant to be a Black person, and how some of the things that I thought other people were thinking of me maybe fit and how some things didn't fit. And I had to develop a sort of a ongoing discussion with myself about who I was and the things that I wanted to put out into the world. And whenever I am faced with some types of microaggressions or discrimination, I know that it has nothing to do with who I am. It has everything to do with who the other person is. And, you have to work on your physical health and your mental health. That is a main focus of some of that work of self-worth and self-respect. And I have created a community around me of people who really support me, who understand my experiences, whether they're, Black men, Black people, other people of other groups. That way I know that in my circle, in my everyday, I have people who understand me and get me. And lastly, I did my own history. I learned my own history, not only of my life history, just thinking about childhood experiences and thinking about interactions with family and early peers, but also Black history and, the contribution that Black people have made to America, and really understanding that experience and really recognizing that, the work has been ongoing for years, and I can just extend that work within my own community.
I love that. And so one of the things that you also just said that was kind of, it really spoke out to me really quick, was just the fact that you have to be comfortable in seeking out those answers for yourself. And I feel like a lot of oftentimes I can speak for myself, it's quick to like look to the internet, look to social media, look to media to like find those answers or find people who look like you. But I think the real work, as you mentioned, is really when you can actually sit with yourself and kind of figure out those answers among yourself. Do you feel that social media or some of these images and media help or hinder kind of that process of doing our self-work?
I think it's a little bit of both. I think the internet can be a dangerous place where you can confirm whatever belief you're seeking. And so if you have a negative sense of self, I think you can find things that can confirm that. I think if you have a positive sense of self, you can you're better able to distinguish what is going to be helpful and what's going to be hurtful. I do think that there has been an increase in really positive, Black work on social media, a lot of advocacy that has been going on that can be really helpful just to find a community, especially if you don't have a community in your area. But I think, it really does come down to being able to distinguish the helpful and the unhelpful sources of messaging on your own. And that takes, I think, a little bit of both.
I love that answer. I mean, in my head, I was thinking the exact same thing. So I just wanted to see what you were going to say. As we're rounding up, I don't want this to be too long-winded. As I was mentioning, we are hitting our 20-minute mark. I want to leave a couple minutes for anybody that's still available or joining us right now if there are any questions. And I have one final question that I think may wrap up this conversation. We mentioned already about how people can do something, whether that be an ally, just regardless of race, how they can help this fight that we're dealing with. But on a more specific level, where or how can Black men find the help that they need? Do you have any resources or any suggestions?
Yeah, so I think the first place that people can go to is their primary care physician, their clinic. Ask, around, are there psychologists? Are there behavioral health professionals that can help me? If you live close to a university, you can get free care from people who are in training. And so you can work with someone who is pretty conscientious about their work, meaning they're really wanting to do a good job, and you get free treatment, and they're usually supervised by someone who has a license, and so you kind of get a double system of support for free. If you're a veteran and part of the VA system, you have a lot of access to behavioral health treatment. And what I tell people when they're trying to find someone to work with or trying to find a psychologist or a behavioral health professional is to kind of treat it as if you would if you're going to a new restaurant. So if you're going to a new restaurant you've never been to, you look at the menu before, you look at the parking situation, you look at the costs, you look at, how you're supposed to dress and what you're supposed to do. And then you go and you try it out. And if you love it, you'll go back. If you don't like it, you won't go back. And so the same feel is for when you are trying to find a behavioral health professional to work with. You look up the website, you can give a call to any professional before to ask them about their services, about their approach to treatment. You look at the types of populations that they work with, the types of issues that they have expertise in, and then you give it a shot. You go in, you talk to them for, that first session. And if it's not a good fit, then you just start the process over again. You don't have any obligation to go back if it's not something that is fit for you. And I do recommend to people to sometimes give it a little bit of time, give it a few sessions, because sometimes you're trying to learn them, they're trying to learn you. And the more that you have that open space to get to know someone, the better the relationship can develop. And sometimes you can be surprised by working with someone who doesn't look like you. I know that sometimes there's a preference to find a Black therapist or a Black male therapist if you're a Black man. But sometimes you can really find someone who is of a different race or a different gender that can be just as helpful as someone who may look like you.
I love that. And so just to wrap it up, I don't see any questions as of now, but I also wanted to add to that for people who still may be a little hesitant about even taking the therapist route. Don't be afraid to just kind of look up things on the internet. Of course, ADAA has an amazing list of resources specifically for the Black community under their Black communities page. They also have, like I said, overall overarching resources, not only just for the Black community, but for a lot of BIPOC audiences, as well as just stuff specific to anxiety and depression. So the first step I would always say, and I'm sure you probably would agree, Darius, is to just be open to learning. Like you said, be open to doing the research and really finding out how you feel. And if that means that you can't start directly at a therapist, whether that be because of insurance or hesitation, don't be afraid to at least start with ADAA and look at some of their online resources and just start to begin that process of really embracing your own mental health as well.
Yeah. And lastly, I'll say is start having conversations with your friends about it. Have conversations with your family about it. If you're struggling with something, open up that conversation, and you never know who has been in therapy before. You never know who may have resources for you. And I think that can lead to a really good sense of support and dialogue.
I will agree. Like I said, on a personal level, that is how I started this whole mental health journey. Like I said, with 2020 and a lot of things that was going on, I couldn't help but say something out loud because I didn't know where to start, you know, and luckily I was able to say something and then ended up looking on the internet, and that's how I found ADAA, and the rest is kind of history. But I agree 100% with you. Don't be afraid to have those conversations. This is one of the main reasons why we're actually starting this series, where we'll be just having conversations with professionals and everyday people, just to kind of get the conversations going, kind of break that stigma, and hopefully help somebody in the process.
Hopefully, yeah, that's the goal.
Right. Well, like I said, I didn't want to hit the 30-minute mark, and I think I've done a really good job at staying under that. Shout out to us, because we talked about being long-winded. I'll pass it back over to Sasha. Maybe she has some last-minute points. And after that, that's pretty much it.
Hi, thank you both so much for joining us today. Dr. Dawson, I just have one final question to round us out. We did talk about the importance of asking questions. If someone's looking to start a conversation with an ally or a supporter, how would you suggest they start that conversation?
Yeah, I think sometimes you have to trust your gut as to who is going to be receptive to that type of conversation. And I think it's really about, saying, hey, I have had this thought about something, kind of thinking of it as like I have a hypothesis, or I have a thought, not something like, I really want to do this, conversation with you, but just say, hey, like, what would happen if, I had a thought about this, or a conversation about, my work here, or who I am as a person in this system, and just open it up. And if they're receptive to it, then you can continue it. If not, then you just try to find someone else. But I think as Black people, we sometimes can kind of perceive who is going to kind of be receptive to that, who is not going to be receptive to that, and so trust your gut when it comes to that.
I think that's a great way to finish it off. Tiara, Dr. Dawson, thank you so much for joining us today. To all of our audience, thank you so much. Please visit adaa.org for any treatment information or additional resources. And everyone have a great day.
You too. Thanks again, guys.